The effort to maintain one's youth, be it in appearance as well as physical abilities, has become a major focus here in this country and around the world. It's why gyms and why professional performance athletic centers just like this have become so popular. The fact is, people just don't want to show their age and look older. They want to remain physically active just as they were in their youth years ago. And just as people are going to plastic surgeons these days to remove their wrinkles, they are also going to medical specialists to repair their aching joints, their twisted knees, and their torn shoulders. They want to be active and be able to ride a bike and throw a ball. One of the foremost orthopedic sports medicine surgeons in the country, who has been playing a key role in developing these new procedures and treating patients from professional athletes to weekend warriors, is located here in New York City. His name is Dr. Jonathan Glashow, and we visited with him to learn about some of the major developments in this exciting field.
I practice a specialty of sports medicine. Sports medicine, while it sounds very glamorous and maybe somewhat vague, really in my practice is the arthroscopic treatment of knee and shoulder problems. And I'm a co-chief of sports medicine at an academic medical center, the Mount Sinai Medical Center here in Manhattan. I work with a lot of doctors, I supervise a lot of doctors, and through courses and writings, I teach a lot of doctors. I consider my role an interactive role with companies, the goal of which is to develop better equipment to better treat patients. So I have an interactive relationship with arthroscopic companies that I suggest ideas to, or they review ideas through me, and we try to foster and further the development of particularly arthroscopic instrumentation to make for easier, better, more successful operations for patients.
I'm an avid kite surfer. I blew my ACL landing a big jump, having a lot of fun, and I was fortunate enough to meet Dr. Glashow. I asked for some referrals from some friends and had great recommendations to him. And what really made the difference for me was that Dr. Glashow really understood how important it was for me to get back on the water quickly. And the most important thing was for me to feel secure on the water with a stable knee. I had a great recovery that was very well coordinated between him and a sports trainer that he recommended me to. He tends to send his professional athletes down this path with a specific sports trainer. Dr. Glashow would make sure I'm stable and secure, and the sports trainer would then push me to the next level. I not only recovered quickly and got back on the water in a few months, but I'm stronger than I've ever been.
A big part of the recovery process after surgery is an integral physical therapy and physical training regimen. We often start off with a traditional physical therapist to reduce swelling, restore motion. However, for most of the patients that we see, their demands are such that that's not sufficient. Many different protocols and sport-specific regimens that we direct our patients to in order that they can maximize the benefit that they get from the surgery they went through. You know, it's not a done deal until they're back on the basketball court or they're back on the football field. Traditional physical therapy is just not at the level to return our athletes to the professional arena or the college arena or even the high school arena. And as patients and their demands get greater and their desires to return to at least as good as they were before increase, we push the envelope to move things faster, and we develop a better, more succinct coordination with our physical therapists and our athletic trainers. Along the way, we augment that with things like the platelet-rich plasma, which is a very exciting tool that we're using to speed recovery and avoid repetitive injury problems. All this translates into a more complete and more rapid recovery process.
A unique look at the remarkable field of orthopedic sports medicine, which is helping people feel good and stay active as they grow older, thanks to specialists like Dr. Jonathan Glashow.